difficult. So I'm going to share with you in the next 15 minutes, like how we have done some out of the box practices. Like whatever Deepak was talking to you, we have kind of systematized that because we believe that systems are going to help us in the long run, especially in institutes. And I'm going to share how we have kind of systematized some of that learning curve practices, or when you're moving from one stage to the other stage. So this is where I think he left. Our surgeons born or made. When he was talking about that, I was browsing, and there are several articles on this. And the message is very clear. The literature suggests that surgical expertise is reached through practice. Surgical experts are made and not born. So that 3% can be like born surgeons. It can be Aik Ahmed, my good friend Gabar Shariat, who does the sutureless scleral fixation. But that is just a small number. But there is a big number where usually they are made by deeper understanding of the nature of expert performance and its development will ensure that our surgical education training programs are of the highest possible quality. Okay, so this was the steps which I think Deepak was beautifully showing. How do you go from the unconscious incompetence to the next stage, the conscious incompetence? And that's where a lot of things happens in your learning. The stages of learning is very important for us to understand. So when somebody is unconsciously incompetent, what we do is you read all those things. You read all the basic books, and then you watch a lot of videos. A lot of resources are there. I don't want to get into those resources, but we also run a beautiful channel called AIOS2025, where we have the best manual small incision series. And for phaco, you have a lot of online resources, including Deepak's and many others in the form of iTube and all that. But again, the next important thing is whatever you're doing, I think you have to understand the basics of it, the basics of the machine, the handpiece, the foot pedal, all these things are very important. And then how that works, the parameters of it, like power, vacuum, aspiration rate. Sometimes you have to spend the time to really understand all this. So before it was like more the sheer volume, but now with all the simulation and wet lab practice, you don't need that numbers to learn and master a technique. So that's where we also use the Help Me See simulator, and we have also studied to see how it really helps. You can see, you get a real feel. For example, this is a simulator for SICS, but you can also do for phaco. You can have a feel like how you are doing a scleral tunnel, like how you see there. You can go at a certain depth and then feel the depth. If you're too deep, it would say you're too deep. If you're shallow, it will say, if you're too superficial, it say there is chance for you to buttonhole. So sometimes you need some of these simulators. Now these simulators are available in Mumbai, in Madurai, and several other places, but you will have to go enroll and make sure you do this practice so that you have a good learning curve before you touch the human eye. The second thing which we developed several years back, so this was what I developed maybe when I was a resident, of putting a human nucleus into a goat's eye. There is nothing like this, I'll tell you. You can put the human nucleus, the one which you have harvested from small incision, into goat's eye, and you can practice this brilliantly. So this is not done on one side, and you close the incision by suturing, and from the other side you make a phaco incision, and you can really feel how firm the nucleus is, how deep I should go, when the red glow is seen, when do I stop, when do I chop, or even if you are from 4 quadrant to stop and chop or phaco chop, you can do all that. See that beautiful rotation which you can do. You can practice all that just on a goat's eye with a human nucleus which you have harvested from small incision. So even new techniques, I asked my team to get back to the wet lab. If let's say that you are externalizing a haptic, go to the wet lab, practice that, and then get back. Let's say that you're putting an iris hook, go to the wet lab, practice. It's not that the wet lab is only in the beginning, but even in the longer period, when you're moving from one technique to the other technique, this really helps. So what we do back at home is like one-on-one training. Each resident, at least for the first 25 cases, somebody will be sitting in the side scope and then teaching them. How deep you are, how long the tunnel is, how short it should be, and things like that. So that is called one-on-one training. But that is when you are getting that consciousness, but you are still incompetent. So this is a very important stage. When somebody needs to go from this stage to the next stage, which is the conscious competence, sometimes we leave them to do alone, and then they face a lot of problems, or you criticize them after they have a complication, or when you review that case, if you have a recording. So what we have done consciously is the next 25 case. So this, again, thanks to COVID, we learned during COVID, where there is a saying that never let a good crisis go waste. So we didn't want the COVID time to be wasted. So we experimented a lot of things. And one is this called the GoPro, which is a live surgery which you can see from a GoPro. So we gave a name for it. It's called GoPro Operations Live on Facebook. So it's a very simple thing. Now your GoPro goes to an adapter like this. So this is a Chinese made adapter which goes into your beam splitter, and it can be fixed in just couple of minutes. So before somebody operates, if they want to be prepared, and then you go live on the GoPro app, which is called the Quick app on your iPad or in your iPhone, and then you can go live, and then somebody can see your surgery live. So that's the best part. If somebody can see you in the second 25 or 50 patients, and then tell you your axis is small, you need a bigger axis, or your axis is running away, can you pull it back? Your cortex this is not a good idea, your pupil is small, can you get it bigger by putting adrenaline or phenocaine? So things like this, the GoPro makes a big difference for us. So this we call as live mentoring. Like what you see, this is our Facebook page. When somebody is operating, so this is a recording which you see there. The best part is all these cases are archived in that page. So somebody can, the person who has done it can also retrieve that recording and have their own saving of it. But all these help. So it's a kind of a closed channel. Only on invitation people can subscribe and come in. And once they leave, they are also removed from it. And what you see is all live done. So live mentoring happens. See there, if you can see, it says stop and call for help. That means they have gone beyond the limit where if they continue, they'll have a complication. So what we have seen is by doing this, they're unconscious. They become more conscious of what they are doing. The pupil is small, let me put adrenaline. This cortex is sticky, let me do a second hydro to get that cortex off. That really helps them to think at the right time than criticizing them after having a problem. So what we do actually is we have systematized this, the second half of it, the second 25 cases. We have somebody like a senior consultant or a senior resident. So if you see her, she is on their EMR looking at patients, and also there is a screen where the live surgery is playing. So only one or two people will be seeing that, so that we don't want to intimidate the surgeon who is operating also. So they will be seeing, and then whenever they need some kind of an advice, then they would put that advice in the comment. Now where you can't talk directly, but you'll put it on the comment, and the comment will be shown to them on the iPad there in the operating room, like how you see the comment here. So you can continue to put the comment till they operate, but if they are doing a good job, you can just watch and then just leave on them to operate. So what best this can do is, this can help you to do kind of offline and online. So this is another channel which every resident will have. So there are several residents here. If you are interested, they'll be happy to show you. So they are advised to upload in their own YouTube channel somewhere close to 250 small incision and 50 phacos and any other surgeries they do. So the best part is, you can, whenever you have a doubt, you put it on a timestamp like this. And then I can go exactly at that timestamp and then give my opinion there or my feedback there. This is offline mentoring. So it helps not only online but also for offline. So once you have it in the YouTube, you can use all the facilities which the YouTube gives you to do. Unlimited access, unlimited number of things. You just have to put it into that, compress and put it into that. It's going to stay there with you. And you don't have to share that with anybody. You can share with your mentor or somebody who you want to really discuss that case. It may be national, it may be international. So even this we did when we started learning the GATT. My colleague Swati, when she was learning GATT, we were sending this to Davinder Grover on our YouTube. And then he would put his comments. Swati, this suture, your cautery is too much. Your cautery is too less. You have to make the right cautery. Keep your low temperature cautery little away. So some of these tips are very, very important. If you don't understand the tips, especially the side port, where it should be to insert your cannula. So this helps beyond just online, also for offline mentoring. And what we do actually is they sit with the mentor like this. Can we have the audio? So the mentor can discuss with them. So here, I'm just sitting and discussing with one of my residents. I'm saying, see, you're pulling that cortex, and I can see the capsular folds. So that's not going to help you. You have to just do a saline jetting, release that cortex and then aspirate. So things like that, it will really help you when you're doing a little bit of, leave it, it's okay. When you're doing those offline mentoring. And more importantly, we used to call these meetings as complication meetings, but in the recent past we have been calling this as performing successful cataract surgery, reviewing them every week, not to criticize but to say, how we can do this better. And this has helped us to significantly take them to the next stage, which is the conscious competent stage, which is very, very important. And once they go to that stage, I think then the other stages are very easy. To become unconsciously competent, where you're thinking of something else, you're thinking about conference and you're still operating, or you're thinking about what is there for the lunch and then you're still operating. That happens. We do that now, but still if you're conscious, you can do a better job. So we have seen a significant reduction in the complication rates, at least in the last few years. I'm sure you would have seen our chairman giving a talk on the complications. Now we are closely monitoring, at least in Pondicherry after these interventions, especially the resident complication or the trainee complications have significantly reduced over the period. Like how you see here, it's been from 4.62 to 3.13 to 2.47. That is where you're really learning those surgery. Your first 100 to 200 is one where you're really learning the surgery. And once that complication comes down, the confidence level goes up, and that helps them to go quickly to the next level. So I think this is where the mentors really come, where you can really help them, pull them back, and make them from conscious incompetence to conscious competent stage. So these are some of the practices at least we are doing. I think I'll just quickly show you. So this is the YouTube channel, which if you have any questions on that part, I'll be happy. But we have a few of the residents, who are right here. If you are interested, they can show you exactly how that Facebook Live works, or even the YouTube channel where they upload. Because what we have seen is this is what the next generation need. They are into more of social media, and they really kind of exercise all this in their day-to-day activity. So once you show them how it's being done, then they quickly elevate it to the next level. For example, we were saying them to save it on a hard drive or in their cloud, but somebody came and said, I can do it on YouTube, which is much more simpler than what you are saying. So these are things which, once you start talking to them, they can with their ideas and with their expertise, they can elevate it to the next level. So if you're interested, you can show. Can you raise your hands, people who can show them? So if you have any questions, I'll be happy to take, because the other speakers have all left. But anything related to this or with the innovation, I'll be happy to take. Yeah. Exactly. So there are a lot of simple innovations. Like whatever I'm showing you, they are also not very expensive. See, when it boils down to recording, right? So there are expensive recorders. Sony comes up with different prices, which goes into your beam splitter, and then you need a scope to attach that and all that. But there are mobile-based adapters, where you can just put it to your side scope. If you have a side scope, they put the mobile and record. The GoPro, which I was showing you, is the most less expensive I have seen, at least in my life, which makes brilliant videos. It may just cost you 1.5 lakhs. The GoPro the adapter, and also an iPad to that. But the most important thing is that's not the regular GoPro, it's a modified GoPro. So that was modified by a company called Backbone in US. So a lot of people just buy a regular GoPro and then they call me. I said, it's not the regular GoPro. You have to get it from that Backbone. So what they do is they remove the front part of it and they put another lens so that it can be used for any microscope, even a lab microscope, because the video quality is so good, so they can use it in any microscope. I can go and see. I was seeing live when the glaucoma session was going on. Now I was waiting for my talk and I was seeing live this particular surgery, which was done some 58 minutes back. So like this, you can have all these things archived, in that particular page. So if you go to that page, you have everything here. You have everything here. So anytime you can go play that particular case and see what happened. If somebody wants to do a kind of an offline work. So this is how you can see somewhere if somebody needs a help, you can put a few comments so that they can quickly react to this. Like just centering the eye is sometimes important. You just center the eye, and then these are some people who have already kind of going to the next stage. So whenever they need, like don't use adrenaline when your pupil is fully dilated. Then it doesn't dilate when you really need it. These are stuff which sometimes you have to put that in the right time. And this is the channel, like how it really helps the residents to kind of archive all this, like what you see here. So they can put a timestamp and ask their mentor. Harni, you want to show quickly how it works?
For example, in this case, so this case I shared with my senior, and he has seen my video and commented with the timestamp. So when I click this timestamp, it will go to that point exactly, and I can compare the comment with that point of the video. And also here I'll put which case and the grade of cataract and which I was done, and what I felt during intra-op. All the comments I'll enter here, and I'll just compare it with my seniors' comments. Like here also, when I click the timestamp, it just goes to that time of the video, and I can just compare, learn from the comment of my senior.
So that's what they can do. They can give you better ideas, and then they can elevate this to another level, which also helps you. Once you have all this, you have a lot of good collection to train your future residents also. I have tons of buttonholes, premature entries, or somebody trenching right into the capsule. So you'll have these collections also, because this is what we need to do. We can't wait them to make those mistakes. Before they make the mistakes, can we bring that consciousness? And that is possible with the technology, and that is possible with the new generation. And that's the message which we wanted to give you in this course also. Thank you again for attending patiently this course, and I appreciate